Hello, my name is Neela, and I'm going to start out with a little history of drug. We have been fighting drug abuse for almost a century. 4 presidents have personally waged war on drugs. Unfortunately, it is a war we are losing. Drug abusers continue to fill our courts, hospitals, and prisons. The drug trade causes violent crime that ravages our neighborhoods. Children of drug abusers are neglected, abused, and abandoned. The only beneficiary of the war we are organized crime members and drug dealers. The United States has focused its effort on criminalization of drug use. The government has spent countless billions of dollars in effort to eradicate the supply of drugs. Efforts of interdiction and law enforcement have not yet been met, decrease in the availability of drugs in America. Apart from being highly costly, drug law enforcement has been counterproductive. Current drug laws need to be relaxed. The United States needs to shift spending from law enforcement and penalization to education, treatment, and prevention. Drug first surfaced in the United States in 1800s. Opium became very popular after American Civil War. Cocaine followed in the 1980s. Cocaine was properly used in health drinks and remedies. Morphine was discovered in 1906 and used for medicine purposes. Heroin was used to treat respiratory illnesses. Cocaine was used in Coca-Cola and morphine regularly prescribed by doctors as a pain reliever. Now I will talk about a balanced approach of prevention and enforcement and treatments that are the key in fight against drug abuse. The 2010 National Drug Control Strategy reports highlights 3 national priorities: stopping drug inhalation, reducing drug abuse and addiction, and disrupting the market for illegal drugs. Stopping drug inhalation. No one starts life wanting to be a drug addict. We must teach our children about the danger and consequences of drug use. Teach them what to do when they are offered drug and keep reinforcing these lessons. Research has shown that if a child can reach adulthood without ever having tried drugs, the chances of him ever being addicted are significantly low. The 2010 National Drug Control Strategy lays out a comprehensive support for prevention programs, including building a community-level activities, targeted substance abuse prevention programs in schools, and an institution of higher learning in the workplace, on the roads, in the military, and on the playing fields. This comprehensive approach means educating the public about the danger of drug use, as well as working with medical and pharmaceutical organizations to prevent the diversion of prescription drugs. Reducing drug abuse and addiction. Substance abuse treatment costs our nation over $1.5 trillion annually, and treatment can help reduce these costs by far more than the expense of that treatment. For those who end up hooked on drugs, there are also programs like drug courts that offer nonviolent users the option of seeking treatment. Drug courts provide court supervision, unlike voluntary treatment centers. Nationwide, 75% of drug court graduates remain arrest-free at least 2 years after leaving the program. The perception of risk also plays an important part in whether kids abuse drugs and other substances. Enforcing drug laws. Enforcement of our laws creates risks that discourage drug use. Laws which clearly define what is legal and illegal and send a strong signal for young and old alike what the boundaries are. Price and availability can also affect the choice of whether to abuse drug. Strong drug enforcement affects the price and purity of drug and impact demands. A study released in 2005, Marijuana Use and Policy, What We Know and Have Yet to Learn, by Rosalie Piccolo, found that price matters and marijuana prevalence rates are responsive to change and perceived risks. Thank you for listening.